Hello and welcome to this talk on the difference between type 1 and type 2 diabetes. My name is Michael Albrecht. I'm an internal medicine physician. By the end of this talk, we should be able to define diabetes, understand the function of insulin, determine the main differences between type 1 and type 2 diabetes, and understand some of the lab tests that can be used to differentiate the two conditions if the type of diabetes is unclear. What is diabetes? Diabetes is a condition where the average blood sugar level, or glucose, is too high. The excess blood sugar over time damages organs throughout the body, and having diabetes increases the risk of several medical problems, especially if you have it long term. And these diseases and conditions include heart disease, such as heart attacks, stroke, peripheral vascular disease, eye disease and blindness, kidney failure. It's the #1 cause of needing dialysis in the United States, and something called neuropathy, which is where the nerves in the feet and legs can be damaged, and there's tingling, pain, numbness, and ulcers that can develop in the feet. We also need to understand what insulin is in order to understand the differences between type 1 and type 2 diabetes. Insulin is a hormone secreted by the pancreas to help lower blood sugar after we eat carbohydrates. Insulin signals cells, especially muscle and liver cells, to pull blood sugar out of the bloodstream to be stored or used as fuel. Without the insulin working properly, our blood sugar remains elevated. Diabetes is either a problem of not making enough insulin, that's type 1 diabetes, or not responding to insulin, that's type 2 diabetes. 1 diabetes is an autoimmune disease that destroys the pancreas. What is an autoimmune disease? An autoimmune disease is a disease where somebody's own immune system attacks part of their body. So auto means self. So if you're self-immune, that means your immune system attacks yourself. And in type 1 diabetes, our immune systems, or the patient's immune system, attacks the pancreas and destroys it. The pancreas normally makes insulin. So if you destroy the pancreas, you destroy the production of insulin. You no longer make insulin. In type 1 diabetes, the cells that make insulin, which are called beta cells, are destroyed. A minority of cases of diabetes are type 1. So only 10% or so of cases of diabetes in the United States are type 1 diabetes. And type 1 diabetes is treated with insulin because their pancreas no longer makes insulin. Without insulin, these patients would die. Type 1 diabetes is often diagnosed in children, teenagers, and people in their 20s. Type 2 diabetes is much more common than type 1 diabetes. 90% or more cases of diabetes in the United States are type 2. Type 2 diabetes, unlike type 1 diabetes, is caused by insulin resistance. In insulin resistance, blood insulin levels are actually high, but our cells don't respond well to the insulin. Our pancreas thinks the blood sugar is still high, so it says, let's make more insulin, and it puts out more insulin into the bloodstream to try to overcome the high blood sugar. But the problem is the cells don't respond to the insulin. Multiple factors can lead to insulin resistance, including genetics, obesity, and hormone imbalances. Type 2 diabetes is often diagnosed in middle-aged or older adults, but it has become more common to be diagnosed in children due to increasing rates of childhood obesity. Obesity, or being overweight, is the #1 risk factor for developing type 2 diabetes. Type 2 diabetes is treated with numerous types of medication other than insulin, especially medications that improve insulin resistance and/or assist with weight loss. A healthy diet and exercise are good for all types of diabetes for general health, but lifestyle changes are especially important in type 2 diabetes, such as diet, exercise, and weight loss, because these things all improve blood sugar levels or can even reverse type 2 diabetes to the point where patients with the type 2 diabetes no longer require medication to maintain normal blood sugar levels. Type 2 diabetes is different than type 1 diabetes because type 1 diabetes patients require insulin to survive, whereas type 2 diabetes patients have plenty of insulin. So normally we treat patients with type 2 diabetes with other medications such as metformin, SGLT2 inhibitors, and there's brand names such as Jardiance, Farxiga, Invokana, and Steglatro. There's the DPP4 inhibitors such as Januvia, Onglyza, and Tradjenta. There's GLP-1 medications that also assist with weight loss in many cases, including Ozempic, Mounjaro, Trulicity, Bydureon, Rybelsus, and Victoza. Insulin is still sometimes used in patients with type 2 diabetes in late stages when nothing else is working. Some medicines that we used in the past and are still used sometimes for diabetes are sulfonylureas, including glipizide and glyburide, and thiazolidinediones such as Actos. It isn't always clear to doctors right away whether a patient has type 1 or type 2 diabetes based on their clinical history. For example, some patients seem to be just on insulin, but maybe they were diagnosed with diabetes in their 30s and they're kind of in between the ages of where you would diagnose type 1 versus type 2 diabetes. Maybe they're a little bit overweight and maybe it's just a little hard to tell what kind of diabetes they have. So some lab tests can help differentiate the two conditions. One of the types of lab tests that can be used are called autoantibodies. Auto means self, and antibodies are immune system components. So autoantibodies means antibodies that attack yourself. And they're mistakenly attacking yourself. And in the case of type 1 diabetes, again, what is attacked is the pancreas. And so some of the autoantibodies that attack the pancreas that can be detected in patients with type 1 diabetes, but usually not patients with type 2 diabetes, are anti-glutamic acid decarboxylase or anti-GAD antibodies, insulin autoantibodies or IAA, and islet cell cytoplasmic antibodies or ICA. C-peptide is another protein that is normally secreted with insulin from the pancreas, and levels are often low or undetectable in type 1 diabetes. Again, these tests can help in the diagnosis of type 1 versus type 2 diabetes, but are not always 100% definitive. And so what they really add is just another clue as to what type of diabetes patient might have. And just to recap the two types of diabetes, so we have type 1 diabetes, which is the less common type, about 10% or fewer cases in the United States. Type 1 diabetes is an autoimmune disease, which means that the patient's own immune system has attacked their pancreas and destroyed the insulin-producing cells of the pancreas. Type 1 diabetes is treated with insulin. Type 2 diabetes is the much more common type of diabetes in the United States. 90% or more of cases of diabetes are type 2. Type 2 diabetes is caused by insulin resistance rather than the lack of insulin. And type 2 diabetes is treated with diet, exercise, weight loss, and numerous types of medication. Finally, I wanted to put a plug in for my new clinic, BrightMed Clinic. It's a new internal medicine practice I'm opening in Lansing, Kansas in July of 2025. If you're in the area and need a doctor, I'm now scheduling new patients. Please call or text 913-667-0800 and we'll get you scheduled for your first appointment. You can also go online and use our website to schedule at www.brightmedclinic.com. Some of the values of our clinic are that patients come first. Your opinion matters a lot to us. Patient education will be very important, and expanding the clinic over time to help as many people as possible. Thank you all for listening and have a great week.